Today is the meeting is recorded, so you can keep your video off or your audio off or on. I love the interaction. I love seeing your faces. That's one of the reasons why I leave my face on, because I want to make sure that you all get the benefit of seeing a live person talking. Through the whole pandemic, we just saw webinars with no much face interaction, but you know, it's good to see us, so we see each other. So thank you, Brenda. Thank you, Brian. Thank you, May. Thank you, Steve. Thank you, everyone, for joining. You guys are great. Interestingly enough, I had prepared this slideshow for the meeting today with all of the revisions for the June 3rd, right? I'm just going to tell you straight out, they're on hold. Cal OSHA held a meeting this Wednesday at 5 p.m. And it's amazing. Everybody was up in arms, and the comments from many Californians to the board were submitted. And we were all talking about how difficult these restrictions are and how they don't really align with the Centers for Disease Control recommendations and the California Department of Public Health recommendations. So as it is today, I'm going to ask you for a little bit of patience, because I myself, I feel like I'm being pulled and tugged in different directions, trying to really keep up with all of this. As it happens, there will be another meeting on June 17th, and we will see how the board or how the votes will go. Hopefully, the votes will all go towards aligning with the CDC and the California Department of Public Health current guidance. That's why my presentation, although I'll send you the slides and you'll have them, what I want you to know and what I want you to think, the way I want you to think is, let's analyze what the California Department of Public Health is saying. Let's analyze what the current guidance is by the Centers for Disease Control. And that's where we want to gear our efforts toward, because the current revisions, the document I'm going to show you, the proposed revisions to the actual regulation are many, they're lengthy, and they're not in place yet. So that's what's so interesting about this, is they're not in place yet, and they may not be in place. So I attended a couple of webinars a couple of days ago, and you know, law firms, lawmakers, risk managers, we're all trying to, you know, let's put together policy for this, and let's, you know, put a face covering policy in place, and now let's also do a de-escalating techniques in case we see a little bit more of the workplace violence issue, you know, come up, because of the situation that we have now with the vaccination versus unvaccinated people, and how that would be divisive in our place of employment. And yes, it would be divisive. It would bring issues of not just confusion. Hey, am I supposed to wear a mask? Am I not supposed to wear a mask? Or if we see people wearing a respirator, hey, that's because they don't vaccinate. How come you don't vaccinate? And issues of maybe a little aggression, maybe a little concern. How do we handle those things? And so what we see is that, you know, we've gotten to even brainstorm and ideas as to, hey, let's get into even reviewing our workplace violence policies and make sure we have something in place for de-escalating techniques. I still recommend them because these issues are still going to happen. Nevertheless, and we'll talk about it in a bit, but nevertheless, I just want you to see that all of these things are not in place yet. So if you've heard all of the many Cal OSHA still restrictive issues of masking even beyond June 15th, when Californians are supposed to get back to more of a normal life. Well, that's where the revisions didn't really fly. And that's why Cal OSHA got into this emergency meeting just this Wednesday, this week, last Wednesday. And they were really listening to, you know, representatives from unions and associations, the General Contractors Association, and school districts from all over different counties, and plain old workers who said, you know what, I've been wearing a mask this whole time, you know, getting old. In comments that were highly controversial, they only gave each of these participants 3 minutes to talk and say what they thought about these proposed changes after the June 3rd revision. And let me tell you, these revisions did not fly. It just didn't sit well with all Californians. And many of them, I have a feeling, will not stay. So with that in mind, I'm going to really, Lindsay, I'm going to ask you to just let us know, when is the next airborne transmissible disease standard class that we have?
I want to say it might be this month. Is it this month?
I know it's this month. This is the
I think it's the
22nd.
28th. I'm registered for that. I believe it's the 20,
Oh.
28th and 29th, a Tuesday and a
Thank you,
Wednesday.
Brian. Thank you so much. So I really encourage you to take that one if you're in healthcare or if you're already compliant with the aerosol transmissible disease, because it will, that's a more restrictive regulation, and that won't change much. So we will review how it applies, how we're doing still infection control at the workplace for settings that, skilled nurse facilities, nursing homes, healthcare clinics, even settings such as those where it's outpatient clinical settings, dermatologists, ambulatory surgical centers, etc. Sometimes my English and my accent betrays me, but as long as you understand me, we're all good, right? So it'll stay pretty much stricter than the rest of us. But for all of us that have employees covered under the emergency temporary standard, which is basically all of us, because very few of us have workers that are in unique standing alone worker cells, right? Which would be the only case where the emergency temporary standard wouldn't apply. These standards still apply. So
I'm sorry, that's the 23rd, 22nd and 23rd of this month. Tuesday and
thank you
Wednesday.
so much, Brian. So make note, everyone who is already having to comply with the actual aerosol transmissible disease standard, because that one still, a lot of the recommendations still stand. PPE, respirator use still stand. This is what we're discussing today are the revisions that were proposed, which included even the voluntary use of respirators, which also caused a great amount of very controversial comments from all sorts of employers, associations, employees, etc. As always, my disclaimer, remember this is for informational purposes only. I am facilitating information. I'm not a lawyer. Like I said, I'm an OSHA outreach trainer, and my objectives for today are as follows. Understanding the timelines for the implementation of this emergency standard and the proposed changes. Mentioning at least two of the most interesting challenges employers will face while implementing these changes, such as the N95 mask under the voluntary use, because those will be required under this proposed changes, or would have been required, which I don't think will fly, right? So today, the way we're going to talk about it is it may happen, but it may not. So remember, these are bi-weekly updates. And so if you have unvaccinated employees, you would have to put in place an respirator for voluntary use only program, which is a shorter policy than a respirator protection program or respiratory protection program as required by law. And the voluntary use would bring about the issue of training more than anything, but it doesn't require medical evaluation and it doesn't require annual fit testing. I'm still very distraught by this issue because, as you all know, if you've ever worked with a respirator or an N95 mask, you know that they are restrictive to the airflow. So it is difficult to breathe in. For those of you in the construction environment or outdoor environment, you have to take into account, sweat, humidity, heat, etc., because that just makes it much harder to breathe. And so people are less likely to wear them. And so employers are going to be forced to stock up on N95 masks for voluntary use for workers not to wear them, because they don't want to wear something that they have the option of not putting on. Lots of issues, as you can see. And then third, briefly review the language of the proposed changes in the drafted regulation, which I'm not going to go over the entire thing, because what I'm thinking today is these things may not take place. And the reason is because in these emergency meetings, the response from all Californians has been, hey, the entire country is getting back to normal. Our test positivity rate is staying in the 1%. So we're doing really great. We're seeing a steady decline. And we're going to keep watching for our vaccination status. And only 15% of our Californians, which are the children, right? People that cannot get a vaccine because it hasn't been approved for anybody under 12. Only 50% of our population cannot get vaccinated. And we still have, I think in California, it's 2/3 of the population who are already vaccinated. And nationwide is half of the US citizens, so, or the adults that are able to get vaccinated. So because of this, and because of the requirement also to discuss vaccination as an issue of importance, we are seeing information being disseminated, more people getting vaccinated, and the additional requirement to bring it to the place of employment, meaning in your training, if you haven't held a training under COVID-19 prevention that includes the benefits of vaccination, do so within the week, do so right away, because one of the added requirements that I think are going to stay in place for sure is include in your training the discussion of the benefits of the vaccine. So you're not forcing anyone to be vaccinated, but you are educating and disseminating information about hey, the vaccination is good for this and this reason. And there's actually videos. And Kaiser Permanente, I have Kaiser, as you all know, I've always told you guys. I have Kaiser, that's my health insurance. And they sent me a video. They texted me information to get the link for a video. And it was very easy, click here, 2 clicks. And then I got a video that talked to me about the vaccine and, some frequently asked questions, such as, well, if it was produced so fast, how do I know that it is safe? It goes over that. And that's one of the issues or the key changes in this proposed regulation that I think is going to stay in place. And that's the discussion with your employees about the safe or the safety of the vaccine per the authorities. Don't you come up with ideas of why it's safe or your own opinions about vaccination, because as we know, vaccination is a controversial topic. So just give them the information based on the science that is already out there. The Centers for Disease Control have videos on it. Kaiser has the video on it. So just provide them what is out there as part of this training, which will stay. Okay, and moving right along, and ask questions if you have any questions. Remember that we have a chat box, or you can just unmute yourself and just interrupt. I don't mind, right? So here it is. It's been changing so rapidly, and it's just so, as you all know, throughout this entire pandemic, we started weekly. Now we're bi-weekly. I've tried to stay as non-controversial as possible, but let me tell you, some of the emotions really, get you going. And this is one of those. And this is the reason why OSHA has been having this back and forth with the California Department of Public Health and holding these emergency meetings, because it's time where, politics and a pandemic and everything just hit us at once. So it's been interesting. And so this is the changes to emergency temporary standard. By the way, one of you asked me, hey, do you think this standard, we should really put them in place? Because, after all, by October, we really won't have to follow any of this stuff. It's an emergency temporary standard. So who cares, right? It's going to go away. So I wanted to tackle that a little bit, because when you go to the OSHA website, the first thing you're going to see is, hey, there are changes to the emergency temporary standards. And just this week on Wednesday 9th, the OSHA, the board, held a special meeting to hear from the California Department of Public Health on new face covering guidance. The board decided to withdraw. So listen to this. The board decided to withdraw revisions to the emergency temporary standards. So those are the ones that I had prepared for you today based on the June 3rd proposed revisions, because everybody was ready to just put them in place. We had such little time from now till June 15th. So hold on to your horses there. This meeting today, it's actually good news for you, because most of you who are my client or who have been taking care of following along, right along with these requirements, know that the emergency temporary standard brought a regulation under the section 3205.1.2, right? But 3205. And it brought along a requirement to have a written program, a COVID-19 prevention program, right? And as you've been with me every 2 weeks or every week or every 2 weeks, you've been making your changes and you've been updating. Well, until June 15th. So listen to this. Although California is scheduled to reopen fully on June 15th, there will be another meeting on June 17th. Your emergency temporary standard, your COVID-19 prevention program stays the same without any changes till June 17th, that we will know more whether or not they voted against those revisions, which I think a lot of those are going to go away because everybody was up in arms, right? It is so hard to help our university plan. Yes, yes, and plan for the return of your students right now. I understand. So I really, and this is where I want to help you, Jennifer, and this is where I want to help you, all of you in this call. Focus on the California Department of Public Health and the CDC recommendations. I really, truly, and strongly think, because I've been following with OSHA consultation and enforcement, I've been following through. And for right now, what you have as standing, your emergency temporary standard, as you knew it since November 30th, stays. So keep that in mind. Plan according to that, Jennifer. So this is a lot of noise. And that's what I'm trying to tell you. This is a lot of noise in the background. And I know if you've participated, I applaud you. I like that we were all there. I was in the meeting and you know, I'm listening to all the frustration. I mean, the frustration in the voices of the callers, because they were only given 3 minutes, right, on one of the meetings. And they're trying to say everything that they know because of science, because of experience, because of personal what's been going on with them in their personal lives during this pandemic, and it's hard. So for you and for all of you, stay, I always say this, keep your nose clean. Stay with what you have right now. Make improvements, start planning according with the actual California Department of Public Health recommendations, which is not law. But if you keep your program as you had it according to the regulation that was in place after November 30th last year. Remember, we had a long discussion about the emergency temporary standard and what it required and all of that. You are good. So today I'm going to highlight those things that I think, and this is my opinion, remember, are going to still stay in place, right? Because of all the noise that I've been hearing. So I'm trying to filter it out for you. Jennifer, keep it as you had it after or starting December 1st, 2020. Now, review the documents I'm going to give you today. So I'm going to take the links and show you these are the documents you want to focus on, because I really believe that's where we're going to go to. We may not, right? But on June 17th, when I listened to the meeting, I think they're going to vote against those a lot of those proposed changes that I had prepared for you. But I'm happy. I'm really happy because I'll tell you why, and it will go on. Does the law allow for employers requiring vaccination for their employees? So yes, as a standing unit, as a business, it's like the no shirt, no service policy. You can put that on your window. Remember, May? You can say no shirt, no service, and you can say, I'm sorry, but you reserve the right not to provide services to those that, no shirt, no service. Same thing here, right? You can require vaccination status. Nevertheless, you get into a lot of different laws that you need to really study and get into. So what most of the risk managers are doing right now is advising their employers. So what I advise, May, and I'm not a lawyer, and I've always done this disclaimer, I'm not a lawyer, but in my practice, when I get this question that you have, I always tell them, first, consult with your attorney, right? Number 2, don't keep copies of their vaccination cards, but you can ask them, because the EEOC, okay, so the Employment Fair Commission is saying that the EEOC is saying that you can actually ask for vaccination status without requiring proof of it, because that would not elicit protected information by HIPAA, or because of ADA laws that you would be infringing upon. So make sure that you know how your process is going to be. And the best thing right now that we're all at is, just ask. And if you want to see proof of vaccination, you know how they get their cards, you can see the card, just don't make a copy. So the best thing you can do, May, is have a list with the names of all of your employees. This list has to be kept confidential, and then put the date when you asked for this information and whether or not they're vaccinated. And you can actually put there a note if they brought you the card, if they showed you the card, but don't keep a copy of the card, because then that is a medical record, and would be subject to Cal OSHA's requirement for medical records, which is 30 years plus term of employment, which is so unfeasible and so ridiculous, and we don't want to get into all of that. So just make sure that you, at this point right now, until we know what else will happen, a list with the names of the employees, and that list, keep it confidential, and you can rely on their word, or you can ask to see the card that they've been vaccinated, but don't keep a copy. And I hope that answers the question. So listen to this as we see it on the screen. Cal OSHA will present recommended revisions to the board, which could be considered at a future meeting as early as the regular meeting on June 17th. So we will see whether or not those revisions will be considered to pass, or they will be voted against. The protections adopted, and in blue, read this please with me, the protections adopted in November 2020 will remain in effect. So as you visit the website, you will see that this hasn't changed, that the information I have been giving you stays the same, even though there's a lot of noise behind the curtains, even though there's a lot of proposed changes, and even though there's a lot of talk about, oh my goodness, now I'm going to have two camps of employees, the vaccinated and the unvaccinated, and now everybody's going to be angry at each other. They don't know when to wear a face mask. Let's calm down. Let's keep it as we have it right now. And yes, employees are going to ask us, hey, but wait a second. On June 15, everybody is reopening. So hold a meeting with them. Just have your powwow or your regular production meeting, office meeting, safety meeting, and tell them, listen, guys, I understand June 15, the economy is reopening. You will be able to go to restaurants and movie theaters, and life will be a little bit more like we knew it before. Now, here at work, because we have Cal OSHA, and Alba has, Alba, and she's talked to you about what OSHA is all about. If you're my client, if you're not my client, you haven't had the training with me, just make sure that you tell them, we've done the trainings on COVID-19, etc. We don't go yet by what the Centers for Disease Control say. We go by what Cal OSHA says, because OSHA is for the protection of the worker. And the laws for the protection of workers are a little bit more strict. And that's what you just have to tell them. So until we know more about how many of those restrictions are going to be let go of, we cannot change what we are doing until now. So make it clear. One of the things that I want you to take with you today is the best thing you can do right now, when there's so much noise in the background, is keep it clear and simple. Keep it simple, right? Just tell them we are still more strict. Until June 17th, we don't know which things are going to stay, which things are going to be dropped. But the mask wearing, I understand, is a little bit confusing, because you are required to still wear it while you work for me. Let's say you operate a restaurant, and this is one of the interesting things. If you operate a restaurant, because of this that you see on the screen, that emergency temporary standard, your employee is required to keep that mask on while serving people as they come in a restaurant. People in the restaurant are not required to wear a mask, especially if they are vaccinated. Right? It's like, it's June 15, reopen the economy. I can come in a restaurant, not wear a mask. So you employee, you could go clock out and then eat at that same restaurant without wearing a mask. This is how inconsistent right now things are. Nevertheless, what do I always tell you guys? Keep your nose clean, because this is how things are till we know exactly what we're going to do. Bottom line, stay with your same program that went in effect November 30th, 2020, that we put together as your COVID-19 prevention plan. And until June 17th, we'll know if what we're discussing today will pass or not pass, right? So now, this is the actual way it's looking right now in Cal OSHA's website, right? And then it basically goes through the things that we've talked about, which is the guidance and the resources. and it talks about COVID-19, the temporary standard, and it's the same. It hasn't changed at all, even though we're so close to June 15th. Well, by the way, if you attended my webinar 2 weeks ago, there was one change that was pretty strong and very good, hopeful, and bright, on the bright side of things, which was in regards to vaccinated people, right? If you have a positive COVID-19 case at work and you have a list of 15 employees that were in close contact with that person, if they're fully vaccinated and they don't have symptoms, you don't have to exclude them from work, which brought relief to you, employer, because you know now that if they're fully vaccinated, even though they were identified as a close contact of that positive COVID-19 case, that you do not have to exclude them from work, which was one of the things that we had in place because of this emergency standard, right? So those are the things that you changed. As you've been with me, these bi-weekly webinars, you know of the changes that stand and they are already in place. And that one stands, that one is already in place. So that's the May 5th, 2021 update, and it's reflected in the OSHA website. So that's why I go back to saying, keep your nose clean. This is in the website, you can do that, right? But the rest is still the same, guys. It's still the same, even if we have a list of proposed changes. And what are those proposed changes? So let me take you back to those proposed changes. So enforcement. The rule continues to be enforced after there was a period of 2 months from when this emergency standard went into place till February 1st, where they would not assess monetary penalties and they would take in account your good faith effort. Guys, it's way past February 1st. You should have your COVID-19 prevention program in writing with all of the requirements of this emergency standard. That you cannot say, well, you know, since this is just temporary, I didn't think it was so important. You have to do it. Keep your nose clean, do the right thing, have it in writing, because otherwise, if you get a complaint, there's a couple of things that are going to apply. OSHA can show up at your place and start issuing monetary penalties. That wouldn't be good for any of us, right? Not for you because you're already suffering from the pandemic, and not good for the employee because the more employees that make complaints, the more problems for employer, less profits, less businesses that are thriving, less jobs. So it's bad for everyone. Do this. Today, more than ever, it is the time for you to put an emphasis on your safety programs. So if you can walk away with something is, number one, do training where you explain about the vaccination because it'll be a benefit to everyone. Just explain, don't get into your opinions. And number two, focus on your safety programs, right? Because everything is going up. September of 2021, there's a proposed changes to the rates. It's one of those historical changes where rates are going to go up. Workers' comp rates are going to go up. That affects you. It's not good for you, employer. The other thing is a new law, AB 1175, which also allows for employees to complain to OSHA, and OSHA will not give you a chance to have notice that they will go and visit you. Nowadays, many times the OSHA deems it appropriate, they will give you a notice that they want to show up, visit your workplaces, and make an appointment, and that gives you a chance to be ready to prepare. That new law would take that away. So enforcement's still there. I wanted to show you that it's way past February 1st, 2021, and you should have this in writing and you modify it as you go. The next thing is the presidential executive order on protecting worker health and safety gave permission for a national emphasis program to take place. And what a national emphasis program is OSHA saying, you know, there's a hazard right now in the actual workplace. There's a hazard that is very prevalent and we need to protect our workers. So the national emphasis program augments the OSHA's efforts addressing unprogrammed activities. What does that mean? They now will put more money into going and visit employers that historically have shown more cases of whatever the emphasis program is all about. And in this case, it's COVID-19. So if you've had outbreaks, if you had major outbreaks, and those of you following me throughout this entire series, you know that an outbreak is 3 or more cases within a 14 day period, and a major outbreak, 20 cases within a month, right? So if you're having those issues, more likely you are going to have one of these visits by OSHA, because right now it is a national emphasis program, what they call a NEP, right? And it's because of presidential order starting in January this year. Thank you, May. I'm glad you got that answer. And Laura also has a question here. Does it need to be part of the IIP, or can it be an attachment? Listen, Laura, I really, really advise that you have it separate from your IIPP, because if they ever show up at your workplace, there are certain facilities that are going to get more visited than others. And those are the ones that have high rates of injury, that have had a lot of COVID-19 cases, or that have had employees that complain to OSHA. So if you're suspecting that you might get and remember, what is a high hazard employer? I've explained this in past webinars, but I'm going to tell you right now, is anybody with an X mod of 1.25 or higher. What is that? Okay, the experience modification rate is basically a number that tells your workers' comp that you are having 1.0 means you're at your industry average for injury and illness. Below 1.0 means that you're below the industry average. 1.1 and above means you're above your industry average. That means you're having more injuries than the rest of the people that do the same type of work that you do. And so 1.25 and more, OSHA targets you. There's an actual high hazard program here in California where they have two methods to get, to draw from and visit these employers that they're considered high hazard. So you don't want to be there. But if they visit you, Laura, you want to make sure you have this separate document. One is your IPP, one is your COVID-19 prevention program, which follows a specific outline. And what is that outline? The actual program that they gave you from OSHA. There's a model program. So Laura, if you want at the end, I'll give you a link for the actual program, because you got to follow that format. I've even told you guys, those that have followed me, make sure that you keep even the OSHA symbol that says model program, erase the word model, but at the bottom, it says revision and it tells you the date. Keep it there so that if OSHA ever shows up, they can see that you derived your program from their own plan. Wonderful, wonderful, guys. These are great questions, right? And so there's a lot of timelines, and I wanted to discuss that. That was one of the objectives, right? The June 3rd brought those revisions. There's a proposed language, this proposed regulation that brings about the issue of face coverings, right? The issue of vaccinated versus unvaccinated workers, and the issue of respirators for voluntary use. So these proposed changes are still strict. They do not align with the CDC and the California Department of Public Health recommendations. And that's why everybody went up in arms and they started saying, well, wait a minute. How is it that California is reopening? We have good rates right now. Positivity rates are low. We don't have that many hospitalization. Everything is in the decline. We're going to actually do away with the tier system, which brings a list of specific sectors outside of that tiering system, and we can actually go back to a more normal life. And there's only some very few exceptions, such as mega events, which bring about the issue. If it's more than 10,000 people that are going to be indoors or outdoors, you got to require either vaccination status or proof of negative COVID-19 test. And aside from that, there's really very few restrictions, right? But now, the California, the OSHA ETS, emergency, and when I say ETS, that means Emergency Temporary Standard, says, well, we are here to protect the health of the California workers, and we understand that. But as I discussed 2 weeks ago, some sectors are having more outbreaks than others, or more numbers than others, meaning more COVID-19 cases at work than others. One of those sectors was agriculture, right? And they also have shown historically less vaccination rates. So less employees go and get the vaccine. So this is why it's so important to also discuss that during training, not with your own opinion, I repeat, but show one of the videos or the science that is available to you through NIOSH or CDC. Reliable sources only. No, don't just download something from YouTube that you're not sure who put together. It has to be something that it is either directly from CDC or NIOSH, right? So the vaccinated versus unvaccinated issue is that because now we have people that vaccinated. Now, I even discussed it during my heat illness indoor proposed rule. I said, you can start thinking about, if you have a workforce that is fully vaccinated, they don't have to wear masks and they don't have to distance. They don't have to do the physical distancing, and you don't have to have the physical barriers because they're fully vaccinated. And after June 15, with the reopening and the CDC recommendations, you can do that and you can start working towards that goal. The problem with that, even as I told you guys that would be a good idea, the problem is that it is going to be very rare for any of you employers to have a fully vaccinated workforce. You may have a fully vaccinated area, like a warehouse or like a crew or a group of workers that may be fully vaccinated, but sometimes you will not have a full group, or maybe just one person will not, or will either refuse to get vaccinated because of personal beliefs, because of a medical condition, or some other legitimate reason. And remember, the word legitimate is different from one person to another. It means different things for everyone. And it would take a court of law to define really what that means, right? It always goes back to what would a court of law and a jury and a judge consider reasonable or considered legitimate reasons. So we don't want to get all the way to there. We just want to know what's available to us right now. And the EEOC website says you can request verbal, vaccination status from your employees without eliciting more information. So don't do follow-up questions. Don't say, oh, so are you fully vaccinated? And explain to them what fully vaccinated is, right? Because there's, the completion of the series, or if you've had the one dose, that's considered fully vaccinated depending on which of the two types of vaccines that are FDA approved they took. So there's definition for fully vaccinated. If they've been fully vaccinated, you can request to see their vaccination card, but don't keep a copy. That once again, right? And that provides the issue of, well, if this guy is not vaccinated, now the recommendation is that that person, because that person is not fully vaccinated, everybody has to wear a face covering. Now, this brings issues and problematic issues for a lot of you, because just by process of elimination, some of you are going to realize, well, I know my friend so-and-so is vaccinated, and I know these two are vaccinated because they were talking about it and they said they got their vaccine. So people talk, and they're saying that they're vaccinated, but the only one in this room or in this department or in this meeting, so-and-so, he or she must be the one that is not vaccinated, and it is her fault that we have to wear this face covering, right? And so you can start getting these concerns and aggressive behavior because of these issues of two camps or two types of employees. And that's one of the things that this proposed regulation brought about. And this is why I think the issues of keeping the face coverings when a room has mixed workers, everybody has to wear a mask, may not stay. I think we are gonna gear everyone, including employers, towards the same recommendations that the CDC and the California Department of Public Health are going towards. And that is pretty much what we know after June 15th, meaning if you're fully vaccinated, you don't have to wear a mask. And, just appealing to those that are unvaccinated that they should wear a mask, but you do not enforce it, that kind of thing. And I'm going to review that document with you. June 9th, then they did the emergency meeting where they they want to cancel those revisions. And we will know if they vote against those revisions in the June 17th meeting. June 15, California reopens, and with that, a lot of the sectors are able to, open their doors. There are no capacity limits. A lot of these people are able to not wear a mask if they're fully vaccinated, and it is okay for them to be close to each other, even they're from different households, stuff like that. We worry about people that are immunocompromised and they're not vaccinated, because we know historically, because of what we've learned from this virus, that people that are not vaccinated can still get infected. And even if they don't have symptoms, they can spread the disease. So with all of this information, we know we don't, ask them, hey, why don't you get vaccinated? Is it because your religion prohibits it? We don't ask any of those things. Please don't. All this regulation requires is that you have a list, right? And do not keep records for right now. Don't keep copies of their cards. And that's one of the main things that I wanted to discuss with you today. The board may further refine the regulation in the coming weeks, so stay tuned. We're going to continue doing this bi-weekly webinars for you guys, for the purposes of informing you and keeping an eye on what's happening. And these are the documents I wanted to share, because I got to make sure that I give you the info. Let's see. Now you can't see anything. There it is. I hope everyone now can see the document from the California Department of Public Health, released on May 21st, 2021, which basically says this is the current face mask guidance. And then there's one that will take place after June 15th. So there's a difference. And I'll just take you to that one, because we're getting so close to that next week, right? Here, there's a link to the blueprint activities and business tiers chart that we're doing away with starting June 15. And the only exceptions basically says are for mega events, with the limiters noted below for mega events, based on the following general public health recommendations. So these are the general public health recommendations that are in place that do not align right now with the emergency temporary standard, but that we think that we are going towards, okay? Because the revisions were still strict. The June 3rd revisions were still very strict, and most likely will not stay. Very few will, such as the one that I just told you. Make sure you include in the training vaccination benefits and some of the frequently asked questions that are now put in videos by the CDC, etc. So restrictions applying to indoor and outdoor settings, vaccine verification or negative testing. It's only required for indoor mega events and recommended for outdoor mega events. Capacity limitations, there's no restrictions, physical distancing, no restrictions for attendees, customers, and guests, right? So pay attention to this, no restrictions, physical distancing, no restrictions for attendees, customers, and guests, but it's different for employees. So that's what we're talking about today. Until these things change, you continue doing what you're doing. You continue asking them to put on a face covering, because that hasn't changed. Masking, follow current California Department of Public Health guidance for face coverings. You're going to see what that is all about. And listen to this. Travelers, that's different. Of course, if you have people that commute and they're your employees, remember to include them in your OSHA COVID-19 prevention emergency temporary standard. There's a travel advisory. You can also put that as an attachment, right, to your COVID-19 prevention program. So it stays. Employers are subject to the emergency temporary standard as it is since November 30th, 2020. It hasn't changed. That's the key. Then it goes into mega events. Read this if you do mega events, if you work in setting up and putting together mega events, or if you're going or planning into doing some indoor mega events. And remember, mega events are considered mega events characterized by large crowds greater than 5,000 indoors or 10,000 outdoor attendees. So that's what a mega event is, right? And it tells you, for indoor mega events, verified there's fully vaccinated status or pre-entry negative test. So these are all recommendations. These are not laws. Every time you see a document out here by the California Department of Public Health, that's a recommendation. It's the public abiding by these health recommendations, right? Now, when something is law for employers, it would be because of a OSHA reg. And in this case, that's a temporary standard. So additional, this is all mega events. And then listen to this, the requirements and recommendation for negative testing or vaccine verification will be in place effective June 15th through October 1st, 2021. So if you are putting together a mega event, indoor or outdoor, this is the guidance you want to follow. You're going to get a copy of my presentation, my slides, which has all of these links in it. I'm not going to give you the PDF version of my presentation. I'm going to give you the one where you just click on the slide and you get straight to the link. The California Department of Public Health will continue to provide updated guidance for youth, healthcare, and high-risk congregate settings, because those are the groups that are a little bit different, because we worry about them right now. If you have immunocompromised status, you may be more susceptible to dying from this disease, and also you are able, or you're infectious for a longer period of time. You know this if you're in healthcare. So instead of 10 days, it's 20 days for you to be quarantined, etc. Very good. So let me take you to another document that I want to discuss with you, and I'll take care of that question in a second. Hold on, let me see. If not fully vaccinated, are face shields still required by Cal OSHA emergency revision if there are no barriers when interacting with customers face-to-face indoors? Yes, Maria. So let's say they're not fully vaccinated for whatever reason, and you have to have them there, have an interaction with the public. Yeah, it's recommended that they have at least a face shield if their medical condition doesn't allow them to have a face covering. So it could be a face cover and a face shield. Now, Maria, I want to make sure that you understand this part, or that we all understand this, me included. This is a proposed revision, is not in place yet. But this, exactly the example you're giving us, is part of the recommendations by the California Department of Public Health. Okay, so yes, you would have to make sure that they wear a face shield because they're not fully vaccinated and they have this interaction with customers. So although, California fully reopened and all of that, it's one of the recommendations, especially if this person is not fully vaccinated. What if they are self-reporting? They're telling you or giving you information, I have a medical condition, and you have a small business and you cannot send this person to work remotely, because that's some of the steps that we talked about. This COVID-19 pandemic brought us this whole procedure, this whole thought process, where the first thing you want to do is remove them from the hazard, which is the beginning and the principle of safety at work, right? Hierarchy of controls. Remove the worker from the hazard. But if you're a small business, hey, someone's got to take care of the customers. And if this person has seniority, you're going to keep them there. They're not fully vaccinated, or they have a condition that they reported to, self-reported. You did not ask, right? Because you don't elicit information. That's protected information, but they told you. So yes, this is part of the recommendation, exactly what you're talking about here, Maria, that they do wear a face shield if their condition allows. You're going to now delve into the process of accommodation per the ADA laws. So check it out with your lawyer or your human resources person, but accommodation will take place. Thank you, Maria. You guys are great. I love your questions. So I hope I'm making myself understood in the sense that I know my audio is a little different because I'm not in the same setting. So tell me if audio is not excellent in your comments. That will help too. I've been getting really great comments about it, and we haven't had any problem. In 2 weeks, I will not be in this. I totally stopped sharing, didn't I? Let's see. Here. Beyond the blueprint, everyday life. This is a handout or a poster that you could also take a look at. I have the link here, and it basically goes into, what we are hoping to see starting June 15. Everyday life will feel like before COVID. Nevertheless, we do have groups of people that we want to protect. Californians will continue to follow state masking guidelines because, if you want to wear a mask, it's all right. You can still wear a mask, especially if you're concerned because of your health or the health of others. Mega events, again, just kind of gives you a quick summary of what I discussed. What's next? I like this bit. California will keep a close eye on COVID-19 vaccination and infection rates over the summer and keep these guidelines in place until at least October 1st, 2021. I really think these guidelines are the ones that are going to stay, right? Schools, healthcare settings, some other public settings have to follow aerosol transmissible disease standard and ETS, the emergency temporary standard. So that's why there's a little bit of a disclaimer at the bottom here. It's a one-page handout that I think was very helpful to just kind of summarize what I just told you guys. And then guidance for the use of face coverings. This is the document that I told you. I think it's going to align with the after June 3rd, those revisions that they wanted to take place, I don't think all of them are going to take place because they were stricter than this that you see on your screen. So the guidance for use of face coverings, they give you a background, and then it says guidance for individuals. Masks are not required for fully vaccinated individuals except in the following settings. And so there's exceptions by setting or by individuals. So public transit, so whenever workers get on a bus, commuting, face mask is going to be required. Makes sense, you guys. We're in a post-pandemic world. It makes sense. If you think about safety, you're going to get in a bus and some of those people in the bus are concerned because they're immunocompromised. Whatever the thing is, you're wearing a mask to protect them. Or if you are the one that is immunocompromised, you're also wearing a mask, most likely that it is a good fitting mask because you've had all this time getting educated on what a natural mask is. It's not something that's just so thin or with holes, but it is double ply or double fabric, and it just fits nicely, tightly to your face. So it doesn't allow your droplets to go everywhere. And it does give you some protection. It's not like a respirator, but it does allow for some protection, right? Indoors, K-12 and childcare and other young settings, are going to still require masks. Healthcare setting go by a different kind of regulation, which is the aerosol transmissible disease standard. Also, long-term care facilities do as well. In those settings, such as healthcare, long-term care facilities, correctional facilities, detention centers, you have two kinds of employees per se, where some of them are directly involved with the care of cases or suspect cases of COVID-19, and the aerosol transmissible disease standard will apply. You have another set of employees that don't deal with the public or with inmates or sick people, and they don't have that risk of COVID-19 exposure, but still the ETS apply, the emergency temporary standard applies until it is gone and done away with. This is a question I had before. Do you think the emergency temporary standard will completely go away? I don't think so. I already asked Cal OSHA consultation. They think it may if vaccination rates continue to go up and we keep a low positivity test rate. So they think it will go. There's a possibility it will go away, but it won't till October. So we still have to have it in place, I'm sorry, it's just a burden on employers. You have to have it in writing. You have to do all of this. It's just what it is. Let's keep our nose clean, right? Additionally, masks are required for unvaccinated individuals in indoor public settings and businesses, retail, restaurants, theaters, family centers, meetings. And so this is the interesting thing, because how do you know that they're vaccinated or not vaccinated? You just for the public, you're just letting them know what the guidance is, but it's not a law, it's a guide, right? It's what the California Department of Public Health is saying. For your employees, you're required to make sure they do it. And how do you make sure they do it? Well, disciplinary issues have to take place if they don't do what your policy says. So for face coverings, you should have a policy in place already. It should be there. This is some of the notable revisions by the June 3rd proposal that may get canceled, may not take place. So if you're fully vaccinated, no symptoms, no need to wear face covering. If everybody is vaccinated in a room, no face covering. But if you have a mixture of workers with mixed workers, no symptoms, working outdoors, no face coverings, except when working at outdoor mega events, right? So this is wording from the actual regulation that was revised, and they're trying to pass it because of the June 3rd revisions that may not take place. So this is all the things that I had put together for you to discuss today, but that may not take place. I think it's going to align with the documents that I talked to you about. There's another deadline that this June 3rd revision brought to the table, which was the July 31st physical distancing issue, which said, by June 15th, if you're indoors and vaccinated, no physical distancing. I'm sorry, after June 15th, I'm sorry, not by June 15th. This is a typo, I'm gonna correct it. After June 15th, if you're indoors and vaccinated, no physical distancing or barriers. After June 15th, if you're indoors and unvaccinated, no physical distance or barriers if N95 respirators are provided for voluntary use. And this is the thing that everybody goes, what? Right? Because now you have to bring that supply of masks to be available for workers to wear it on a voluntary basis. The best recommendation that we had up until June 9th, that they held that emergency meeting, and we hope this is not going to pass. But if it passes, guys, all of you in this call, you're going to have to get your stock of you're gonna stock up on N95 respirators for voluntary use. You're going to have to really look into what the voluntary use of respirators is all about. There's a regulation for respiratory use in the workplace, respirators use in the workplace, that's 5144. It requires an entire respiratory protection program if you are requiring the respirators to be worn. But if it's for voluntary use, such as in this case, for this revision, after July 31st, you would have to have them available. You would have to have held a training for employees to know that if they are not vaccinated, they are encouraged, and the revision, the actual wording of the law says encouraged to wear an N95 respirator because it protects them against these particles that have the virus. The virus itself is very, very tiny, but it always attaches to bigger particles that are stopped by this filter, the N95 mask. And that's part of the science behind this COVID-19 particle. It is very, very tiny, and the filter on an N95 respirator doesn't stop the virus from going through. But when it's worn on the face, the actual breathing, the actual droplets, the actual person talking around us, it's going to expel aerosols or droplets where the virus is always attaching to either the proteins in our saliva or the actual water in those droplets. So the actual particle is stopped by the N95. And that's why this is part of the proposed language in the regulation where we say, you know what? No physical distance or barriers, but if you're not vaccinated and you're indoors, we want a talk to you about N95 respirators on a voluntary use. Training needs to take place. No requirement for medical evaluation. No requirement for annual fit testing. Because when a respirator is required, such as in the case of healthcare or all of those taking care of suspect cases of COVID-19 or any other aerosol transmissible disease, you have to be in a program where you're medically tested prior to being assigned a respirator and where you're also fitted for that respirator, that model, that particular type of respirator once a year, because our faces change. We go up and down in weight, or we have dental procedures that render that mask not effective. So this is part of the language. I don't see this one passing, but if it does, employers, you will have to get N95 respirators to have them available, right? And then discuss and train your workers. The prevention program still is in place, so you have to have it in writing. So I'm glad we discussed that earlier. Ventilation is key. We continue to use the interim guidance for ventilation, filtration, and air quality in indoor environments. So basically it talks about first step is increasing the outside air into any of our indoor spaces. For those of you in areas where there's too much heat or you get into the issues of wildfire smoke where the quality of the air is not good, you got to take a look into hiring someone, a specialist, so that your HVAC system is upgraded or you're actually setting your filtering or your filtration is doing set in high. There's central filtration is setting high, and that you are doing the best to really trap those particles and not let them be in the air that your workers are breathing. And so there's an interim guidance for ventilation document that I have linked here. So training, this is here what it says. COVID-19 prevention training must now include information on how the vaccine is effective at preventing COVID-19 and protecting against both transmission and serious illness or death. Exclusion from the workplace, this one has been in place and it's already in place. You can do this one already because it is even in the OSHA website where it says fully vaccinated workers who do not have COVID-19 symptoms no longer need to be excluded from the workplace after a close contact. All of you know, if you follow me through these classes, that a close contact is the one that follows the rule of 6-15-24. within 6 feet of distance for more than 15 minutes in a 24-hour period. So it could be cumulative or in a one-time 15-minute being close to someone that is a positive COVID-19 case. And that is a close contact. Once you've identified a list of close contacts, if those close contacts are fully vaccinated, you do not have to exclude them from work. You do not have to send them to be quarantined if they're fully vaccinated and have no symptoms. And the other thing that was added is if they've already had COVID-19 and they've returned to work and there's been a 90-day period that they've been symptom-free, you also do not have to exclude them from work. That's part of the revisions, right? And then there's another issue of special protections for housing and transportation that says you do not have to do all of the things that the emergency temporary standard required in regards to, face coverings and physical distancing if all of the occupants are fully vaccinated, which is very hard, as I said, because it would create that division of fully vaccinated versus non-vaccinated, and it would be very obvious for workers to see who's been fully vaccinated and who hasn't. That would create issues of workplace violence, aggression, etc., that you must address as part of your requirement by Cal OSHA standard in your illness prevention program. And if you have establishments outside of California, the general duty clause applies, where you have to keep your places of employment free of any recognized hazards. And with that, I stop. It's an hour of mind-blowing information. I will have more for you in 2 weeks. For right now, stay tuned. And if you have any more questions, I'm here for you. Thank you, Lindsay. And I'll see you then in our aerosol transmissible disease standard class at the end of the month. Thanks again. Have a great weekend.
Thank you very much.
Thank you,
Brian.
Alba. Thank you, everyone.
Thank you.
Great weekend.
Thank you.
Have a great day.